So let's move on to the Group Insurance Commission, why we're here. Now, first of all, to dispel a little misconception, the GIC is not an insurance company, and I do not work for the Group Insurance Commission. The Group Insurance Commission is, I like to use it in terms of your benefits department for the city of Methuen. They're just the state's benefits department. This is where all the state employees, all the state retirees, now some governmental agencies and some cities and towns and regional school districts go to get access to health insurance. The Group Insurance Commission does provide health insurance to 350,000 employees and retirees, total members. That's one of the most current numbers, 350,000 people. They are the largest purchaser of health insurance in all of Massachusetts. And the Group Insurance Commission is often looked at by other states as a very model agency. They do a very, very good job. They have an excellent staff over there that administers their health plans. When you hear the Group Insurance Commission's name being floated around out there in the Eagle Tribune or in other periodicals or on meetings and so on, don't be disheartened by or get a wrong impression of what the Group Insurance Commission is. To provide health insurance to 350,000 people, they must be doing something right. They are not a scary agency. They're not something to be afraid of. They are a very good and well-run organization, and they are governed by commissioners. And the commissioners, there are 15 of them, most of which come from business and health insurance backgrounds, as well as finance backgrounds, but there are also 4 labor seats on the commission. The commission guides the staff of the GIC, and they approve rates, they approve plans, they approve co-payment changes, and that the like. So the GIC is governed by a commission. They actually have an operating budget in over $2 billion. So it's a very, very large organization. The GIC staff manages all their benefit programs, their medical, their life, their dental, and so on. The staff manages their competitive bid process, their cost quality control, which we'll talk about shortly, their enrollment, and all their communications. So if you were to go to the GIC, the Group Insurance Commission handles everything with your health plans moving forward. The city would still be involved in setting up eligibility for city employees, but the GIC handles it. Now, because they offer health insurance to 350,000 people, they can't just offer 1 or 2 health plans. They actually offer a wide variety of health plans because the state employees obviously live from border to border and beyond the borders of Massachusetts. So the GIC offers 11 different health insurance plans for non-Medicare employees and retirees. And the plans range from PPO plans, which are very, very popular in the marketplace today. They have 4 PPO plans, 1 from Harvard Pilgrim Healthcare, 1 from Tufts, and 2 from a group called Unicare. You may never have heard them, but they are part of a Blue Cross WellPoint out of California. They're a very big company. They have HMO plans. They have 3 HMO products. They have Fallon Direct, they have Harvard Pilgrim, and they have a Tufts plan. And these are what's called limited network plans. Those of us who've been around long enough to remember the HMOs of the 80s, when the HMOs were first rolled out in the marketplace, they were very narrow network. They were very limited to where you could go for care. Well, these plans have made a resurgence in the market as a way of containing costs, because the insurance carriers understand that they can have narrow networks of providers, hospitals, doctors, and so on. They can direct and they can control their costs a little bit better. So the GIC actually has 3 of those limited network health plans. They have 3 regional HMO plans. They have a Fallon Select. Fallon Select is very big up here in the Merrimack Valley with provider networks. Neighborhood Health Plan down near Boston, and Health New England, which is out west of Springfield, one of the largest and strongest HMOs in that area. Now the GIC also offers still a couple of indemnity style plans. Did we ever have Master Medical here in the city of Methuen? Master Health Plus might have been called Master Medical. Well, the GIC still offers a Master Medical-like plan to their subscriber base under the carrier name of Unicare. So you can see there are a wide variety of plan choices at the GIC. And if you decide to go to the Group Insurance Commission, you have a choice of all of these plans. None of these are closed to you. You have a choice of all 11 products in front of you. Next is the Medicare plans. And once again, because of the size of the group, they have to offer multiple Medicare plans. Right now in Methuen, you have one plan option. With the Group Insurance Commission, we have 6 health plan options for Medicare retirees. The 2 on the left are a Unicare Indemnity Style plan and a Harvard Pilgrim plan. Those are national products. They work state to state. There's no restrictions on networks with those plans. And then we have 4 regional style Medicare HMO plans here in Massachusetts. Now, this you may not be able to read certainly in the back of the room, but it gives you a breakdown of where the Group Insurance Commission subscribers, what health plans do they choose if they're non-Medicare. Now, most people, almost 76% of their entire population are in one of 2 plans, the Harvard Pilgrim PPO plan or the Tufts PPO plan. More so, I think, because it's name recognition. We're from Massachusetts, we recognize Blue Cross, we recognize Tufts, we recognize Harvard Pilgrim. Now you will notice that in the plan choices from GIC, there is no Blue Cross and Blue Shield. I don't think that's much of an issue here in this community, but some communities who have Blue Cross products find that to be a concern. But Blue Cross, Tufts, Harvard Pilgrim, we are very lucky here in Massachusetts that we have some of the top-rated health insurance carriers in all of the country. But most people in the GIC are enrolled in their PPO style plan, and another 10% go into their indemnity plan. Now, interestingly enough, I have been, and Boston Benefit Partners has been involved with every city and town and regional school district that has negotiated their way into the GIC. And 80% of municipal employees who are covered and go into the GIC choose one of these 2 PPO plans. They choose a Tufts PPO, they choose a Harvard Pilgrim PPO. Again, I think it's because of name recognition. Now, the GIC, as I stated, their plan costs tend to be less. That is in premium dollars. The GIC has worked very, very hard over the years in trying to control costs. Now, one of the things that you will notice as we get into the details of their plans is that all of the plans for non-Medicare retirees, all of the GIC health plans have tiered co-pays for doctors and hospitals. They have upfront deductibles for their plans, and they have tiered prescription drug co-pays. Now, let me just talk about tiering for a moment. It's a new sort of concept in the municipal marketplace, and even in the private sector, tiered plans are not all that popular. However, all the carriers are introducing these plans on a broader basis in the coming 2 years. What a tiered copay plan means is that the carrier, along in this case with the Group Insurance Commission, has identified doctors and hospitals based on cost and quality, and they assign a copay or a tier to that provider. And it is to incentivize the member of the plan to think and have choice about what copay they want to pay. If you want to go to a doctor that has higher costs and maybe lesser quality, you're going to pay a higher copayment under a Group Insurance Commission plan in order to see that doctor or go to that hospital. If that doctor has met higher cost benchmarks, lower cost benchmarks, and higher quality benchmarks, they have the lower copayments. So it is a consumerism model in the Group Insurance Commission plans that they strongly believe in that helps drive members to doctors and hospitals that have good outcomes and can provide care at a reasonable cost. So all of their plans, non-Medicare plans, have this feature about them. The Medicare retirees have, again, 6 health plan choices, but they have much less cost-sharing features, which means they don't have the upfront deductibles, they don't have the tiered co-pays that the active employee plans have. So for the Medicare retirees in the room that may be your first time looking at Group Insurance Commission, Don't be frightened by this tiering concept. It doesn't affect the GIC Medicare plans at all. Now, I didn't want to make this presentation so long that we couldn't finish tonight. So we put a sample of premiums, because the real issue for most people is, what's it going to cost me to go to the Group Insurance Commission? Now, as I stated, GIC plans tend to be a little less costly. So there are 3 examples of plans under the Group Insurance Commission here. These are, non-Medicare plans. A Tufts Navigator plan. The total premium, now this Tufts Navigator is one of the most, it is the most popular plan under the GIC. $581 per month is the total cost for an individual. $1,413 a month is the total cost for a family under that plan. Now, I'll give you a comparison under Methuen. Your plan from Tufts, total premium is $630 per month for an individual and $1,572 for a family. So you can see the GIC plans are less costly in premium. And this is just an example. If you paid 80%, if the city paid 80%, you paid 20% of what your costs would be. Then there is the Harvard Pilgrim Primary Choice. This is one of their newer limited network HMO plans. It is a very low cost option. It's $480 per month for an individual and $1,173 a month for a family plan. Their Unicare indemnity with CIC. This is a plan like our old master medical style plans that some of us had in the municipal world. It is still a plan that GIC has. Because it is an indemnity plan, it has no networks of providers. It's a national, you go anywhere when you want to go for healthcare kind of a plan. It is the most expensive. It comes with a premium. It is $807 for an individual and $1,882 for a family. This is, I know you may not be able to read this. This will be available on the website on the presentation, and I'm going to give you some other resource information to talk about or explore some GIC information. It's just a skimming of the surface, if you will. The GIC